We have received a few questions. So the first one is about fatty liver. What is fatty liver, and what are the reasons for non-alcoholic cirrhosis among adults if they do not smoke nor consume alcohol? So please educate on fatty liver and solutions.
Main slide, this slide, and if you get a person with this tummy, guaranteed you are having fatty liver. And so sometimes the couple comes and wife says, doctor, husband fatty liver, and she's having a huge tummy. So then we say, not only husband, you also having fatty liver. And these children, definitely, they are having fatty liver. Fatty liver, the number one thing is the obesity. And if you get kind of a fat in your tummy, that, the same mechanism, it goes and deposits in your liver. And why it happens is basically because of the lifestyle and the diet. And if you are overweight, you are guaranteed this excess fat goes and deposits in the liver. That's the most common condition. It's obesity and the high cholesterol and diabetes. Those are the conditions predisposed to fatty liver. If somebody gets fatty liver, guaranteed he's going to end up with high diabetes, cholesterol, high blood pressure, and those things in subsequent years. So how are you going to, and that's the only reason. And there are other reasons which damage the liver. These are rare. It could be hepatitis, it could be accumulation of iron and copper and in the body. Those things are basically theoretical, and we don't see them. And it's basically the lifestyle. And the treatment is, there's no proper medication. If somebody gives medication for fatty liver, that is rubbish. You have to get rid of the tummy. You have to get rid of at least 5 kilos of weight and cut down oily food, maybe beef, pork, then prawns, cuttlefish, and put in lots of oily things to the food and the fast food. That's the only way you can control the fatty liver. And in a way, fatty liver is good, and if you are diagnosed with fatty liver at that point, then you will be careful. And you will be careful with the lifestyle and diet, and you may live a long life without any problem. So don't panic unnecessarily about it, but once you get that message, take it very seriously.
Other than cholesterol, sometimes calcium causes heart problems. How can we early detect it?
That comes, we do a calcium score in angiogram. The angiograms are done by two people. Basically, what I showed to you, it's done by a cardiologist putting a wire and injecting a dye. Second one is putting a dye here and doing a CT or MRI in the heart. We couple it to the calcium score to the film. And indirectly we say high calcium score is not good, because it could go and affect in the heart. But it is not a very strong prediction like high blood pressure, diabetes, and cholesterol. It's a very, very indirect prediction of heart disease. So what I would suggest, don't go serious about it. And calcium, there are benefits as well. Thinking about heart disease, don't control the calcium. On the other hand, don't take calcium unnecessarily also. People take calcium almost every day for years. That's also not good, because calcium goes and deposits in the heart. Even this morning, I got a call from one of my regular patient. I know them for last 10, 15 years. He's a diabetic, came with heart attack. We did an angio, and one blood vessel was completely blocked, 100% blocked. So we had to stent. The other one was 90% blocked. We couldn't do that because of the high calcium level. High calcium, it looked like a concrete in the blood vessel. So they couldn't put the balloon and dilate it because of the high calcium level. But still, it's not a very, it's not an area where we discuss commonly like diabetes, pressure, and cholesterol. Calcium, there are benefits as well. And calcium score is an indirect measure of heart disease, and it is not very reliable, especially in old people, so don't go seriously with that.
There's another question. Apparently on media there has been broadcasted that an HPV vaccine should be given to school children in order to prevent from cervical cancer. Could you educate on that?
It's a completely different topic. Okay. Yes. Human papilloma virus is a virus can cause cervical cancer in grown-ups. It's a viral disease, virus, and when we detect cervical cancer, cervical cancer in elderly people or young people, so we were looking for causes for that. There are a number of causes for cervical cancer. So detect those things, we do this pap smear and things like that, you know, when these the ladies are grown up in their 30s, 40s, and 60s. Human papilloma virus is one of the causes of this cervical cancer. Giving the vaccine among the school children, we feel that we can prevent that viral thing. By doing that, we can reduce the incidence of cervical cancer at some age. So it's reasonable.
How can we control TG? Probably triglycerine, that's what they're referring. How can we control TG? Yeah.
I told you. Triglyceride, if you check the blood report in a lab, they say normal triglyceride level should be less than 200. Right? So suppose one comes with that's normal. It comes with a 300 triglyceride, yes, then most of the time we can control that 300 level. If the person is not having diabetes, not having heart disease, not having hypertension, only with lifestyle. So cut down the beef, pork, cuttlefish, prawns, and oily thing, this 300 will come back to 150. Suppose a person comes with triglyceride level 800 or 900 or 1000. That means it is genetics. Genetics means there are lots of genetical conditions called familial hypertriglyceridemic conditions. These people, they produce cholesterol in triglyceride in their body. Suppose they may be vegetarian, but when they eat starch, maybe bath or bread or whatever, when it is digested, the liver produces triglyceride in the body. So that people, when triglyceride level 600, 700, 800, they need medication. Stop producing triglyceride in their liver. The person with marginal triglyceride, by changing the lifestyle, reducing the weight, cut down the oily stuff, and beef, pork, cuttlefish, and prawns, they can control the triglyceride. Yeah.
Seeking answers for a previous question again, what are the reasons for non-alcoholic cirrhosis among adults if they do not smoke or consume alcohol?
Yeah. Non-alcoholic cirrhosis, again this NASH, non-alcoholic cirrhosis, that's again the same thing like fatty liver. It's very common. And obviously if you drink alcohol, we don't say it's non-alcoholic, no, it's alcoholic liver disease. So non-alcoholic means without alcohol, the liver disease. The causes there are rare causes, like, you know, sometimes our genetics, we accumulate iron in our body. So when we, whatever we eat, the iron, part of the iron accumulate and it goes with maybe the urine, maybe feces. But some people genetically accumulate the iron and copper and things like that in the body. So they could end up with non-alcoholic liver disease. And people who have infection like hepatitis B and C also could end up with. But the most of the time, non-alcoholic cirrhosis is either diabetes, either cholesterol. Those are the two things.
Can vitamin E reduce fatty liver?
No. Non-alcoholic cirrhosis is a hot topic, and almost if you check the liver enzymes in this audience, 80% are having high liver enzymes. So if I can get a medicine for that, so I will be a rich man because there's a good customer basis. So people try various medicine, vitamin E, pioglitazone, lots of medication time to come with little trials, but none of these medicines are confirmed. It's the lifestyle. If somebody asks, then they are begging for a medicine, we try to justify giving something, so vitamin E is a good choice. So otherwise, there's no proven benefit.